Hi everyone, welcome back to another video. Today we're going to be discussing about the use of paracetamol in daily life routine. Before we get into the video, I'd like to ask you guys, so please leave a comment of how many sheepy unicorn you have, as we're trying to see how strong this unicorn army is. And then also leave a like and subscribe because it really helps us with the growth of the channel. Let's hit a goal of 400 likes for this video. That's very easy, as I know we can do it. Anyways, let's start the video. People with high blood pressure who take paracetamol on prescription could be increasing their risk of heart attacks and strokes, a study suggests. Doctors should think about the risks and benefits to patients taking it over many months, the University of Edinburgh researchers say. Taking the painkiller for headaches and fevers is safe, they stress. Other experts say research in more people over a longer time frame is needed to confirm the findings. Paracetamol is widely used around the world as a short-term remedy for aches and pains, but also prescribed to manage chronic pain, despite little evidence of its benefits for long-term use. 500,000 people, 1 out of every 10 in Scotland, were prescribed the painkiller in 2018. If they also have high blood pressure, a condition that affects 1 in every 3 people in the UK, they may be more at risk, according to this trial. It tracked 110 volunteers, 2/3 of whom were taking drugs for high blood pressure or hypertension. In a randomized trial, they were asked to take 1 gram of paracetamol 4 times a day for 2 weeks, a common dose for patients with chronic pain, and then dummy pills or placebos for another 2 weeks. The trial showed paracetamol increased blood pressure, one of the most important risk factors for heart attacks and strokes, much more than a placebo, Edinburgh clinical pharmacologist Professor James Deere said. The researchers advised doctors to start patients with chronic pain on as low a dose of paracetamol as possible and keep a close eye on those with high blood pressures and a risk of heart disease. Arthritis is one of the biggest causes of chronic pain in the UK. One charity, Versus Arthritis, said safer medicines to treat pain were needed as well as other help, such as mental health support and encouragement to be physically active. If you are concerned about the risks from pain medicines, you should speak with a healthcare professional to explore your options, said Dr. James Ellis, consultant rheumatologist at Versus Arthritis. Lead investigator Dr. Ian McIntyre, clinical pharmacology consultant at NHS Lothian, said, "This is not about short-term use of paracetamol for headaches or fever, which is, of course, fine." Many unknowns. Dr. Dipender Gill, clinical pharmacology and therapeutics lecturer at St. George's University of London, said the study, published in the journal Circulation, had found a small but meaningful increase in blood pressure in a white Scottish population, but many unknowns remain. Firstly, it is not clear whether the observed increase in blood pressure would be sustained with longer-term use of paracetamol, he said. Secondly, it is not known for certain whether any increase in blood pressure attributable to paracetamol would lead to an increased risk of cardiovascular disease. A large U.S. study previously found a link between long-term paracetamol use and increased risk of heart attacks, but it could not prove one caused the other. And other smaller studies have been unable to confirm the link. The Edinburgh team said they could not explain how paracetamol would raise blood pressure, but their findings should lead to a review of long-term paracetamol prescriptions. These were previously considered safer than non-steroidal anti-inflammatory painkillers, such as ibuprofen, which are thought to raise blood pressure in some people. The British Heart Foundation, which funded the study, said doctors and patients should regularly think whether any medication, even something relatively harmless like paracetamol, was needed. Dr. Richard Francis from the Stroke Association said further research in people with normal, healthy blood pressure over a longer time frame was needed to confirm the risks and benefits of using paracetamol more widely.